Welcome, everybody. I really appreciate your being here and joining me to talk about what I think is a very important issue for all of us that are involved in care and caregiving, which is really trying to understand other people and their needs, and in order to meet those needs. And specifically, I want to talk about situations that we often encounter when caring for people with dementia or Alzheimer's and other forms of dementia. And very often, people with dementia exhibit certain behaviors that sometimes it's difficult for us to fully comprehend, understand, what it's all about, and sometimes this can lead to a lot of frustration and disappointment and other feelings among caregivers. So my goal is to help you feel better about what you do, okay? And before I say anything further, the one thing I want to emphasize, whether you're a family member, whether you're a nursing assistant or nurse or physician, anybody else involved in the care of people with dementia, you have to know that everything that you need to be successful in this regard, you have within you, okay? Because you know how to love another human being, you know how to be patient, you know how to care for other people. And unfortunately, if you are a professional and have had any training in nursing or medicine, then you have been taught to think and do things differently. And unfortunately, that sometimes gets in the way. Okay, so at the very beginning here, I'm going to try to peel that away as much as possible. Okay, and we're going to pretend, or we're going to emphasize the fact that we're all human beings and just go with that. All right. So let's see here. So there's a special requirement here, and that is that you can't think like a doctor or a nurse if you are one. All right. So how are we going to undo that? Well, I have a very little exercise here that will just take a few moments to go through, just to kind of get you into the swing of things, so to speak. And what I have for you here is a special sequence of letters. It's actually quite familiar. You know the answer to this, and my point in this is to show you that every problem that's before you, you already have the answer. Okay, you may have tucked it away somewhere, or the way that you've been trained to think about things or look at things has sometimes made it difficult for you to find the answer. So here you go. Here's a series of letters. They're in a familiar sequence, and they have a special meaning, and you know what it is. What is that meaning? You're not jumping out with the answer. Well, let me give you a hint, okay? There's 12 of them, and they're in order. Okay, and now that I tell you that, of course, it occurs to you that the first one is a J. It's January. January, February, March, April, May. But as you can see with all this, we are sometimes taught to put things in certain boxes, if you will, that sometimes interferes with our ability to see the big picture. Okay, but again, everything that you need to know to be successful, you already have, you already know it. So I'm not here to teach you anything, I'm here to just give you a chance to practice what you already know. Okay, so, and I'll illustrate that further with a case, and we're going to go over a series of cases and then kind of talk about that. So let's start with this case. Here's a guy, he's been the resident of this home for 18 months. You all are familiar with this situation. You've dealt with it multiple times. This guy, you've heard this story before. In our medical lingo, he requires, quote, total care, totally dependent in basic activities of daily living, dressing, eating, walking, toileting, hygiene. He's frequently agitated, yelling, crying, wandering. He's not able to communicate his needs verbally, and he often, quote, resists care. He wears a diaper. When people try to change it, he often doesn't appreciate that, and he's often resisting people's efforts to do that. And he frequently bites and scratches his caregivers and destroys other residents' property, who I dare say frequently voice the sentiment that they wish he weren't there. Okay? So you've all dealt with this, right? And the first thing I want to ask you about this is not what do you think or what do you do, but I want to ask you, how do you feel about this? Okay? What kind of emotions does this call up in you? Okay? And the second part of the question is, how successful do you feel that you're going to be in this situation? Do you feel really confident that you're going to get this right? That you're going to solve this problem? Well, let me give you some encouragement, okay? You've already been successful, okay? You've dealt with this successfully many, many times. Don't believe me? Here's the patient, okay? This is my son about a dozen years or so ago. And a couple things to point out. Number one, whatever problems we're dealing with, they don't last forever, okay? Things always get better if we can just hang in there long enough, okay? The second thing is that all of these behaviors we're talking about that are so distressing, in a way, you can think of them as normal, okay? They're normal for, you know, they're normal for that stage of brain development or brain function, okay? And when you see that it's a child, there's a tendency to say, well, okay, that's normal behavior for him, and I know what to expect, okay, of him and of me. Now, I've got to tell you, I don't know anything about raising children, and I've got 3 of them, okay? My oldest is 21, and I'm not learning fast enough, okay? So I still don't know anything about them. So I'm not here to tell you that I'm a great parent and I'm going to show you how to do it, but all of this, the issues that we're dealing with are all the same. The behaviors themselves are the exact same, and you have all of this experience to draw on, okay? And the other thing I would just point out with this picture is that we tend to think that the problems that confront us are larger than they really are, okay? Let's make them a little smaller and a little easier to manage. Okay, as the good Dr. Freud said, to understand is to forgive, okay? One of our tasks here is to try to understand, okay? To try to understand what people are telling us without words. Another challenge for us, of course, is to be loving and caring and forgiving even when we don't understand, especially when we don't understand. Okay. That's basically my entire presentation. Okay, I have some additional cases that we can work through together, but in terms of themes, probably the most important thing is that behavior is communication. Okay, well, if behavior is communication, then behavior is not a disease. So forget all about behavior being some disease for which there's a drug, or that a behavior is a drug deficiency state. Okay, let me go back to this situation again here, since I mentioned the drugs, and I'm gonna say one last thing about it, and we're not going to talk about medicines anymore. But supposing this was your son, and you took him to daycare while you went to work, and when you got done with work and you went to the daycare center, the director said to you, well, your son had kind of a rough morning, but we gave him a medicine. He slept all day, okay, and you pick him up, he's limp, he's still groggy, he's obviously wet his pants. How would that make you feel? Okay. Generally speaking, most people would be pretty angry. You know, you'd be angry that somebody did something to your child without talking to you first, without your knowledge or consent. You might be angry because he was behaving normally, and you know, why was that not okay? All right, because ultimately, when we are dependent upon others for care, what we most want and need is to be accepted for who we are. Okay, when I come to live in a nursing home, unfortunately, I know that I'm not going to be the easiest patient to take care of, and I'm quite fearful that I won't be yelling yoo-hoo, but the repetitive phrases will be something less socially acceptable. And so I'm asking you right now to forgive me and to accept me for who I am. I'm trying, okay? But there are situations in my life where I try and I fail, and I need you to love me and accept me no matter what, okay? The other thing I would ask you, and think about this in the context of any relationship that you have. Think about it if you're married or as a parent or a child. Suppose there was a medicine that had no side effects, and it cost almost nothing, so that just the perfect medicine. All you could do is get the intended effect from it. So don't worry about side effects, don't worry about costs or anything. But suppose there was this magic pill, and if someone gave it to you, it would cause you, and let's say again it's your husband or your wife or your parents or your children, your sibling or your boss, your coworker, and whenever they gave you that medicine, it caused you to behave exactly the way they wanted you to. Would you take that medicine? I doubt many of you would, because ultimately it's more important for us to be who we are and to be accepted for who we are, really no matter what. Okay, that's what we need from other people, and that's what other people need from us. So that's all I'm going to say about medicine. Now let's focus on understanding what people are trying to tell us so we can meet their needs. All right. So, and I don't want to belabor this, but behavior is communication, and particularly in situations where people whose ability to communicate with words is limited. Okay, then we tend to focus on nonverbal communication. Okay, there's a universal sign for among children at least for I have to go to the bathroom. Okay, it doesn't require words, and it's spoken around the world. People, if you've ever traveled to a foreign country or a place where the dominant language is not one that you speak, you're trying to understand what people are saying without words, and they're trying to understand you without the words also. Now, I'm going to go another step further and say that I'm willing to bet that most of you actually prefer and trust your nonverbal communication and your perception of nonverbal communication better than you trust the words that you hear. Okay, and I'll ask you this. Supposing there's a difficult situation that's important and perhaps serious, would you prefer to have that communicated to you through a text message or an email or over the phone? Or would you prefer to actually be face-to-face with the person that's sharing that information with you? Okay? I bet most of you would say face-to-face. And the question, of course, is why? And the answer is, I believe, that there's a lot more to the conversation than the words. And if somebody is telling you something and the words don't match what you're hearing or what you're seeing, chances are you're going to trust what you see much more than what you hear. Okay? So for all of us, behavior is communication, and it's our preferred method of communication. The thing that we have to be mindful of is not just what are other people telling us, but what are we telling them through our behavior, perhaps unintended messages that maybe we don't mean. And I say that because when we're talking about people with dementia, for example, and small children and others, people who have trouble comprehending people who have trouble communicating with words, expressing words, also have trouble comprehending words. Okay, so it's a two-way street. Now, a couple things I want to point out, and then we're going to just we'll practice with some real cases of adults. Okay, but it's important to keep in mind that when you're dealing with what you might consider challenging or difficult behaviors, particularly in an institutional setting like a hospital or a nursing facility, the behaviors that you encounter among people who have dementia, these are always reactive. These aren't premeditated, planned out things. They're in response to something. It's like a reflex. There's a stimulus that they're reacting to, and I'll illustrate this. Okay, so it's not, they can't help it, and they're not trying to do it. Okay, the other part of that is that, generally speaking, some of the most difficult ones or the most frustrating ones result from a misunderstanding or a misperception on the part of somebody who has cognitive impairment. They misperceive something as threatening to them, and they respond in a way that you would respond if you were similarly threatened in real life. Okay, and I'll illustrate that in a minute. The other thing that you have to keep in mind is that when people are confused, they have an altered perception, and they have, by definition, they have a limited or impaired or absent ability to understand and reason. Okay, and so trying to reason with people who don't have the capacity to reason, whether it's, I mean, if you're married, you know exactly what I'm talking about. Okay, but that's unreasonable, and it's unreasonable because it doesn't work. Okay, so don't do that. All right. So the behaviors that we're talking about, the things that drive everybody else crazy, these are, you can think of them as a conflict between the individual and the environment. And trying to change the individual never works. Okay, the only thing that's going to work is to try to change the environment in some way. And I'm not talking about knocking down walls and remodeling or anything like that. Mostly we're talking about the human environment, how we interact with other people. Okay, to put it another way, even though you may feel helpless in these situations, the fact of the matter is you have almost complete control over this, because you can control how you behave and how you communicate, and that's what other people are reacting to. Okay, so I guess another point I want to mention is that for any given behavior, which we tend to put in a box and we say, well, that's agitation or something like that, whatever name you want to call it, there are lots of different things that can cause the same behavior. So there are lots of potential messages, and we have to sort out which one it is. Okay? I mean, I'll ask you this question. Why do babies cry? Lots and lots of reasons. Well, as a parent, all I knew was they must be hungry, or they must have to poop, or be burped or something like that. So I had a very limited repertoire, you know, and my kids looked like the Michelin babies when they were little, because they always had a bottle in their mouth. Okay? And most of the time I was wrong. Okay? But if all you have is a hammer, everything looks like a nail. And I just kept banging away, hoping that I'd get it right. All right. So our primary task as caregivers is to figure out the meaning. What are they trying to tell us? Why are they doing that? Okay? And if we put ourselves in their shoes, it often becomes abundantly obvious. The more we know about a person's life, the more we have a context to understand, you know, what it means for them. Okay? For example, I remember recently a gentleman who every evening at a certain time, typically as the sun started to go down a little bit, he would seem to get sort of agitated, and he'd start hollering, and he would make these repetitive sounds, and everybody assumed, well, it's the sun's going down, this must be, quote, sundowning, he just must get confused every evening. And it wasn't until a family member came in and we had a chance to talk to him about his life before he moved to the facility that she happened to mention that, you know, one of the sources of great joy for him was he had a number of dogs, and that they would roam around outside, and every evening he would call the dogs in, and he would get quite distressed if one was missing and so forth. So he was calling the dogs, but he didn't tell us that. He just did it. And it wasn't until we figured that out that we were able to help him to be successful and to know that, hey, the dogs are all okay. All right? And that's something you could do over and over again, no matter how many times he called the dogs. But typically, once he knew that the dogs were in, then his job was done, and he could move on to other things. Okay, so, but just like, you know, we think about a fever as having multiple causes, any particular behavior, you know, could have multiple causes, and no one would take any satisfaction with treating, you know, meningitis with Tylenol, even though you could make the fever go down. So the joy in all of this is really to try to figure out what people are telling you and to be closer in your understanding to them. So I want you to think differently about behaviors in dementia, and we're going to review some of these common ones with specific cases in order to try to practice problem solving by identifying potential meaning. And once we do that, what to do about it is usually quite obvious. Okay? So this isn't something that requires memorization or anything like that. This is just This is what you learned before you ever went into medical school or nursing school, and you were forced to forget or forego. Okay, and what I want to tell you is that same person that was so eager to care for others, that's the person that is needed right now. That's who you are, and just don't stop being you. Be the best you possible. All right, so let's get started. Okay. Now, I guess one last thing before I forget is that when we're dealing with a particular behavior, the first question you might ask yourself is, the behavior that people are exhibiting, are they telling you that they're in distress? If they're not in distress, then that's great for them, okay? We may still have to figure some things out, but if they are in distress, then that should warrant a somewhat different and certainly a more urgent response from us, okay? And basically we want to figure out what, or in some instances who, is causing them distress, okay? All right, so here's some common behaviors, and we'll talk about them. We talk about wandering, agitation, combativeness, getting out of bed, things like that, okay? So again, just by way of review, the general approach, what are they trying to say? What are they reacting to? Sort of looking for that meaning. If they're in distress, trying to evaluate the cause, and remembering that most often these behaviors are situational, and taking a sort of behavior history, which we'll talk more about that, can be very important in helping us kind of get a better handle on, what's going on, when is it happening, what might be the things that a person's responding to, and give us some clues, okay? And since I mentioned the behavior history, the more, two heads are always better than one, three is even better still. And really it just involves getting people together who are involved in the situation to, as precisely as possible, evaluate, often just simply by documenting, when do these things happen, in order to try to look for patterns, okay? If you work in a healthcare setting, it's often the people who have the least power, like the nursing assistants, but who may have the most contact with individual patients, and who often are the least brainwashed by medical and nursing thinking, that can be of the greatest help, okay? And it's similar to, if you're a physician or a nurse, it's similar to how you would evaluate pain. When did it start? How long has it been going on? What brought it on? Does anything seem to make it better or worse? Is there any other symptoms or problems or other behaviors that you're noticing? But in this particular case, the patient, if you will, can't provide any of the history themselves, so you need to rely on other people, other observers, to help you answer those questions. And again, if you're a paid caregiver, professional caregiver, family input and input of other people on the care team are critically important, okay? If you work in a facility where there are multiple shifts, having a log of behaviors can often be helpful over a period of time to sort this out. Interestingly, when that happens, in facilities where they start to keep a log of behaviors, miraculously, things seem to get better. They seem to get better for several reasons. First of all, things tend to get better, okay? All right? It's always darkest before the dawn. And also, because once people start looking for the patterns, things become more self-evident, and whatever seemed to be precipitating things, we stop doing that, and the behaviors tend to go away. All right, another concept I want to focus on, a couple things. First of all, I don't like to think to label people or behaviors as bad or good, because that can be kind of self-fulfilling, okay? We tend to behave differently around people once we if we think they're scary or dangerous to us, and it's sort of like with bees or whatever, they can smell fear, okay? So, and then I just want to introduce you to the concept of mirroring, which is that basically it's the idea that we see ourselves in others, okay? If people around you are behaving in a certain way, that we tend to feel that, and we tend to do that, okay? For example, you're getting ready to go on a well-deserved vacation, okay, this is a trip of a lifetime, and you're at the airport and you're at the ticket counter and there's a really long line, and at the very front of the line is somebody who works for the airlines, and they're well, let's just say they're agitated. They seem to be upset. They're talking fast and in a pretty high voice. My question to you is, how do you feel? Okay? Right away we start thinking, this isn't right. The situation is, things aren't going the way I hoped. We start to worry about things. There's a lot of words involved. They're all in our head. We start telling ourselves different stories. The next thing you know, by the time we get to the front of the line, if we ever get there, we're upset. Okay? That's a sort of a negative example of mirroring. But basically, a more positive example of mirroring would be a smile. Okay? When people smile, it makes other people feel better. Okay? All right. So I put this up for your consideration, but I'm not going to read all this. Again, just be aware of your nonverbal communication. Our primary task here first is to seek to understand what other people are telling us first before we try to tell us anything else, because we want to respond appropriately. We want to meet them where they live. What do I mean by that? Meet them where they live in their mind. Okay? If somebody believes that it is 1967, no amount of talking is going to convince them otherwise. And anything that you might do to try to show them the error of their ways may simply add to their distress. Okay? I'm not suggesting you should never ever correct anybody, and especially if you have a husband. You have to, okay? But just, I ask you, how does that work for you? Okay? Very often, it's not nearly as successful as you think it might be. Okay? And keep in mind, we only have one X chromosome. Okay? So, appropriate expectations. All right. And oftentimes what's required of us is that we change our behavior. Okay? I get anxious. I get to be in a hurry. But the worst thing in that situation would be if somebody else felt that I didn't have time for them, or that I didn't want to be with them. Okay, so we have to be mindful of that. And then as parents, you may be big believers in tough love, and I'm not. Who am I to say I could use any advice you can give me about being a parent? But in this particular situation, there's just only one kind of love. And it's just love. Okay, we're not. What doesn't work here is setting boundaries or things where people have to think and remember. They're not capable of that. Okay? So we just have to be loving and patient and understanding. And just like with your spouse, sometimes what you need to do is just steer them in the right direction. Okay? Not tell them that they're wrong, but just help them to get where they're going. All right. So here's a case. This is very familiar to you also because, by pure coincidence, it's you. Okay? Some of you aren't nearly this old, and I'm older, so I don't mean to offend anybody by saying that. But so you happen to be at a professional conference in another city. You had to drive or fly there, so you got a hotel, and you're sleeping alone in your hotel room. And I'm sorry, this is you, but I realize it could be distressing. I'm not trying to bring up any bad feelings or bad memories, but there you are. You're sleeping, and suddenly the lights come on. You're suddenly awake, and there's three strangers that are standing over you, holding you down. And they're pulling at your arms and clothing, and they're talking in loud voices, and they're telling you to cooperate. My question to you is, what do you do? Fight? You're all going to fight? All right. It's just the two of us here. Okay, let me ask you this. No one else will know the answer to this. No, we won't share this, but I got to ask you a personal question. When's the last time you really kicked somebody's butt? Okay? All right. You're going to be a fighter. What in your life's experience would cause you to do that? You're not a fighter. But you say that because you're not even thinking about it. It's a reflex, fight or flight. Okay? And there's nowhere to flee in this situation. So you're going to do something without thought, as intelligent as you are, that is purely reflexive, that is part of what your brain was created to do. Okay? And that is so basic, that is so hardwired into the most, fundamental and primitive part of the brain, the brainstem, that for me to make that go away in you would require medicines so powerful that they would suppress basic brain function, okay? So we don't want to do that, okay? All right. But you made it through that just fine, okay? It was a simple misunderstanding. And after your illustrious career, 40 years later, having attended multiple such conferences and probably hosting multiple such conferences, now you have retired, you've enjoyed 82 years of success, now you're sleeping in your own bed in a nursing home, okay? And what should happen? But 3 strangers who happen to be people that care for you every day and have done so for years, but you don't recognize them because you've got memory impairment. They're standing over you, they're holding you down, they're pulling at your arms and your clothing, they're talking in loud voices, and they're telling you to cooperate. What do you think you're going to do now? Exactly. You're going to do what you were made to do. You're going to fight and respond exactly the same way. Okay, so as caregivers, of course, the only way we're going to change the situation is we're going to change how we behave. Okay? We're not going to surprise anybody. We're going to let people know what we're doing. We'll remind them of who we are and what we're doing. We will perhaps avoid standing over people because that can be a threatening posture. If we encounter resistance or if it appears that other people might be mistakenly threatened by us, we're going to back off. We might try again in a little while later because, fortunately, they will have forgotten all about it, okay? And again, these behaviors are not planned, they're not conscious, they're not something you have to think about, they just are. They're like reflexes, okay? And when this happens, people typically have no memory of it, no recollection because they have memory impairment. The other thing to keep in mind is that in order for us to succeed in our daily lives, very often we are required to conform to other people's expectations and to environments that have been created by others, okay? Probably, all of you can relate to that in a workplace where there are certain rules that you're expected to abide by, and those rules, curiously, seem to change in ways that are often not rational or even seemingly thought out or planned, but we're expected nonetheless to conform to that new environment, that new reality. In healthcare settings especially, individuals often encounter some of the most inflexible, rigid environments. The hospital is worst of all, okay? No offense to anybody that works in a hospital, but in the hospital, you are expected to be in your room in bed. In fact, there's nowhere else for you to be, okay? And I might add that healthcare environments, unfortunately, are often not very healthy, okay? They're noisy, there's all sorts of environmental hazards, the beds tend to be high, the floors are hard, and so forth. And I'll just say that the hospital environment is so unhealthy that almost every single person in this country, regardless of age, that gets admitted to the hospital typically gets prescribed a sleeping pill, sometimes even before they've met the doctor, okay? And that is because the environment is so unhealthy and so unconducive to sleep, and it is so rigid that it is unwilling to bend even an inch to accommodate you, and you are expected, whether through your own will or through a drug, to behave differently in response, okay? And if you don't, then your ability to remain in that hospital is often jeopardized. So, but of course, if you were to ask the same doctor 6 months later in their office for a sleeping pill and just tell them how wonderfully you slept in the hospital, chances are they would say, well, you're a drug seeker, and they wouldn't give it to you, okay? So in a situation like that, and I'm saying this to you if you are a prescriber for anything, that just only treat diseases, okay? Don't treat behaviors or anything like that. Medicines are intended to treat disease. Okay, so let's talk about this resisting care, and we've got a case to just, we've already sort of talked about an approach to this, but keep in mind, this is a primitive reflexive behavior. We try to avoid surprising people, we ideally communicate at eye level or even lower, and if someone says no, by and large, we need to respect that no means no, okay? And if we try to power past that, it's even more threatening, but also whatever trust there was tends to quickly evaporate, okay? We often are pressed for time. We're expected to be efficient and do things on a certain schedule, but other people with cognitive impairment, they can't comprehend that, okay? And more we need to work around their schedule, okay? Another thing is to have an individual person participate in the task. For example, take a hairbrush, okay? Well, if I were to hold a hairbrush up and approach somebody with it, that's kind of threatening. These things are, it looks like a club, okay? If, on the other hand, I put it in their hand, and I held their hand, and I lifted it up, and I started brushing their hair with them, then they would understand that what it was. It's not nearly as threatening, and they may actually be able to participate and do more. The same with a toothbrush. Try sticking something in my mouth, okay, and I don't know what it is. At a minimum, I'm going to spit it out, okay? So again, put the toothbrush in their hand, talk to them about what you're doing. They may not have the mental wherewithal to do these complex tasks, which requires you to do multiple steps in sequence. But if we break it up into a single task and we assist them with that, once we get the toothbrush to their mouth, at that point, they can usually take care of business. Okay. All right. We talked already about conforming to an environment, and just keep in mind that many people, everybody to some extent, finds comfort in routines. Not everybody who ever comes to live in a nursing facility, whether it's for a day or a week or 10 years, is used to going to bed at 8 o'clock at night or earlier and getting up at 5 or 6 in the morning, okay? Some people work the night shift their whole life, okay? Some people are not morning people, okay? And we can accommodate that in facilities by letting people work different shifts, but as far as care is concerned, whether it's the hospital or nursing facility, they're all supposed to work on our shift, okay? All right, this doesn't always work that well. And people who have never taken a shower in their life but have always taken a bath are going to have a great deal of difficulty understanding why they need to take a bath now, okay? And particularly if they're very modest and private, they're going to have even more difficulty understanding why other people have to see them naked.